I am a physical therapist. I've been practicing for about 15 years. I also have been doing a lot of costume design for local theater, so I do a lot of sewing for that. So I kind of combined those two and shifted my efforts from costumes into making masks. I've been unemployed for the last month, and probably for the last 3.5 weeks, I've been pretty much constantly sewing face masks for people.
Oh, I thought it was a great idea. I mean, she's extremely talented. She's been sewing on and off. We're involved in community theater at the Upper Mainline YMCA, and she does all the costumes for that. So it's something she enjoys doing. For her, obviously, it's something to keep her occupied and her mind off other things. We do have 3 kids, so she's has her hands full with that, and me working here at home. And obviously the fact that it's helping other people is great.
I first started within the first week of being out of work. I work for a small outpatient practice. I had to make some pretty tough decisions of whether to continue to work or to stay home with the kids during this time. And the risk of coming in and out of the house and being in other clients' homes and settings was just a little overwhelming. So I had to make a tough decision to be here with the family. So I felt I could take the time and my skills to help my colleagues. So that's what I started with. So I started sewing them for my coworkers, made the first 10 for them, and then had some friends that knew that I had started and started asking. So I've donated to Devereaux, Chester County Hospital had a program where you picked up material and you made the mask and returned it. So I've been able to do that. And then now with the new guidelines that they're recommending that everyone wear a face mask, I've been getting a lot of requests from friends, families, neighbors. So I've been very busy.
Devereaux is one of the largest private nonprofit behavioral health care organizations in the country. And we serve adults and children with behavioral health needs. And we are located in 12 different states. We have 13 centers, and we meet the full continuum of care from adolescent and child psychiatric inpatient facilities to adult vocational and group homes and child and adolescent residential, and then a whole continuum of outpatient services as well. In an effort to ensure that we are able to keep everybody healthy, it's really important that we have full PPE for everybody. And while we do have a large supply of PPE equipment, N95s, gloves, all of those kinds of things, people go through masks very, very quickly. So Devereaux has worked hard to partner with people like Carrie and the Lehigh Valley Mask Bandits, who made us 7,000 masks in just 10 days because of the volume of our need. So we are continuing to partner with people throughout the community, both here in Pennsylvania and nationally, to ensure that every one of our children, adults, and employees are masked.
Take me through the process of making a mask.
Oh, it is a long and tedious process. I don't have any elastic. Elastic is really hard to find. So your basic surgical mask uses elastic behind the ears. So I have to create those bands themselves. So it's a lot of cutting and ironing to make the ties. And then the actual face mask is probably the simplest part. They're washable. So they're made out of cotton and flannel. The wire is removable. And there's a pocket for a filter, so those can be removed and they can be washed. I would say each mask averages just under an hour to make each mask. So it's there's a lot of cutting out the patterns. There's a liner pocket. There's a wire pocket, and then the 4 ties. I'm averaging making 10 to 15 masks a day, and that takes me 10 to 12 hours. So it's a lot. Just being a healthcare worker and having been fit for the N95 masks, I know what that fit feels like. So I'm trying to simulate that as much as I can with cotton and flannel for people to wear, because I think it's important that you wear it well and it does what it's supposed to do and really help to seal up as much as you can around there to help prevent the spread of infection.
Devereaux also has turned our corporate offices into a sort of a part of our supply chain. We've ordered bolts and bolts and bolts of fabric, and we have turned over a lot of our contracts people, our finance people who are spending their days cutting fabric and then shipping bolts of cut fabric out to anybody who, through the Devereaux family, is willing to make masks. And these have been our clients, our employees. These are friends like Carrie. And so we have focused a great deal of our effort and attention on the safety and well-being of our staff and of our kids and our families so that we can provide the important mental health services that we need to provide while we're keeping everybody safe.
I'm asking for donations for the products right now that I'm able to make. I have some connections. My mother-in-law is a quilter, so she has some material. So I've been able to keep most of the costs down pretty low so that I can donate. But people have been very generous and very supportive. So we're doing okay. There is kind of a network, a community with social media that I've been able to find. There's a group called Masks for Montgomery County that I've been following, and they are providing to different facilities, and they put the word out, we need so many masks. I'm an essential worker, I need some masks. So that's been one route. The other way is just, I've been trying the Chester County, that was through a friend, they've been able to connect that way. And then because I've worked in healthcare for the last 15 years, I have some connections at different facilities. So been able to find where the need is that way.
So a couple of years ago, my husband and I decided that it would be a very fun thing for all of us to make pajama bottoms for ourselves for Christmas. And so we got sewing lessons for all of the kids. And I've got 3 children. And we went and took sewing classes together. And little did I know the role that it would play and how important it would be. And it's been wonderful for my kids to be able to give back to society in a meaningful way. And they've been busy cutting fabric. They were part of the fabric cutting brigade over at our corporate offices. And so they've been cutting and sewing and assembling masks. And then they come over with me on the weekends and are able to drop them off so that we can keep the supply coming.
My role in mask making is basically I just get the fabric and I sew it together, and then my mom puts the straps on, and so we do like a rotation kind of, where we do 1 piece of fabric and then 2 pieces of fabric, and sometimes like it's hard because the fabric gets stuck a lot. I like wearing these masks better than I like wearing like the actual masks because they look a lot cooler than the other masks, and I think the people at Devereaux also like cooler masks than just the plain ones.
You know, we're all in this together, and everyone in the neighborhood is trying to figure out a way that they can lend their services to help out those in need. Radnor's all about giving back, and you know, the Carrie Kabbalah and the entire family have always given back, and this is just another example of when they think people are in need, they're willing to step up and help out.
I feel like I have a place that I can fit into this, and this has been a way for me to try to find some balance between feeling guilty as a healthcare worker for not being out there on the front lines. I have worked previously in hospitals, in ICU settings, and so I know what it's like there. I know what it looks like to be on a ventilator. I've helped people come out of comas and things like that in my career. So I feel like it's very important for me to help prevent the spread of this. So that's where I'm coming from for this. That's how I got here.